Brain-eating amoeba outbreak in South Carolina, what you need to know. Imagine this. A microscopic organism, invisible to the naked eye, silently thriving in warm fresh water and capable of causing a devastating brain infection. Terrifying, right? This isn't science fiction, it's reality, and it just hit close to home. Health officials in South Carolina have confirmed a case of an infection caused by the infamous brain-eating amoeba, as reported by WIS on Monday night. But here's where it gets even more unsettling. While the case was confirmed during the week of July 7, authorities haven't disclosed its exact location. The culprit behind this alarming situation is Naegleria fowleri, a single-celled organism that thrives in bodies of warm fresh water like lakes and rivers. According to the Centers for Disease Control and Prevention, CDC, when water containing this amoeba enters the nasal passages, typically during activities like swimming or diving, it can travel to the brain and trigger a rare but deadly condition known as primary amebic meningoencephalitis, PAM. Though cases are exceedingly rare, with fewer than 10 reported annually in the United States, the infection is almost always fatal, making it one of the most feared waterborne threats. In a statement provided to WIS, South Carolina health officials emphasized that testing for Naegleria fowleri isn't mandatory, and the state doesn't monitor individual infections or provide detailed information about specific cases. They also noted that while recreational water users should assume the amoeba could be present in warm freshwater environments, the likelihood of contracting PAM remains extremely low. However, this raises an important question. If the risk is so minimal, why does this story capture so much attention and fear? To better understand the threat, let's break down what we know about Naegleria fowleri. Infections typically occur after someone swims in freshwater sources, such as rivers or lakes, especially during prolonged periods of hot weather. As temperatures rise, these bodies of water heat up, creating ideal conditions for the amoeba to flourish. Once inside the body, symptoms of PAM can emerge within days, often starting with headaches, fever, nausea, and vomiting. As the infection progresses, victims may experience severe neurological issues like stiff necks, confusion, loss of balance, hallucinations, and difficulty focusing. Tragically, the disease moves quickly, often leading to coma and death within 5 days, and nearly always proving fatal within 1 to 18 days of symptom onset. Despite its ominous reputation, there are steps you can take to reduce your risk. For instance, wearing a nose clip or simply holding your nose shut when jumping into fresh water can prevent the amoeba from entering your nasal passages. If you're soaking in hot springs, keep your head above water at all times. Additionally, avoid stirring up sediment in shallow areas, as the amoeba tends to thrive in muddy environments. And when rinsing your sinuses or cleaning your nasal passages, opt for distilled or boiled tap water instead of untreated fresh water. It's worth noting that drinking water contaminated with Naegleria fowleri poses no risk, nor can the infection spread between people. A small silver lining amidst the grim details. While the thought at encountering a brain-eating amoeba might seem like something out of a horror movie, it's essential to remember how extraordinarily rare these infections truly are. Still, the mere possibility has sparked heated debates among scientists, policymakers, and the general public. Should states do more to test for Naegleria fowleri? Could increased awareness save lives without inciting unnecessary panic? These are questions worth exploring further. So what do you think? Do you feel reassured by the statistics? Or does the idea of this microscopic menace lurking in our waters leave you uneasy? Share your thoughts in the comments below. We'd love to hear your perspective. Brain-eating amoeba kills 12-year-old boy. Lake Murray horror. Imagine the unimaginable. A family's world shattered by the loss of their 12-year-old son to a rare and deadly brain-eating amoeba. This tragic event has left a Columbia, South Carolina family reeling as they grapple with the sudden and devastating death of their beloved son, Jason Carr. Jason, a student at Hand Middle School, succumbed to an infection caused by Naegleria fowleri, a microscopic organism found in warm freshwater sources like Lake Murray, where he had been swimming. But here's where it gets controversial. While the family mourns, They are also determined to uncover the truth behind their son's death and ensure that no other family has to endure such a tragedy. The family's attorney, Tyler Bailey of the Bailey Law Firm, released a statement expressing their profound grief and gratitude for the community's support. The family has hired the firm to conduct an independent investigation into Jason's death, driven by a desire to understand how and why this happened. They are also deeply appreciative of the care and compassion shown by the medical staff at Prisma Health Children's Hospital, Midlands. The South Carolina Department of Public Health, DPH, confirmed that this is the first reported case of Naegleria fowleri in the state since 2016. The CDC explains that Naegleria fowleri is naturally present in soil and warm freshwater sources, including lakes, rivers, ponds, and hot springs. In rare instances, it can also be found in poorly maintained swimming pools, splash pads, and even tap water. The amoeba typically enters the body through the nose while swimming, leading to a severe brain infection known as primary amebic meningoencephalitis, PAM. This infection is almost always fatal, with only 4 survivors out of 167 reported cases between 1962 and 2024. And this is the part most people miss. The infection cannot be contracted by swallowing water containing the amoeba or by person-to-person contact. Early symptoms of PAM include headache, fever, nausea, and vomiting, which can appear anywhere from 1 to 12 days after exposure. As the infection progresses, symptoms may include a stiff neck, confusion, lack of attention, loss of balance, and hallucinations. South Carolina officials have assured the public that the risk of contracting the infection remains low. To further reduce the risk, experts recommend limiting the amount of water that enters the nose by holding it or wearing a nose clip when jumping or diving in fresh water. But what do you think? Should more be done to educate the public about the dangers of this rare but deadly amoeba? How can we better protect our loved ones from such a tragic fate? Share your thoughts in the comments below, and let's start a conversation about how we can prevent future tragedies like this one. Brain-eating amoeba in Lake Murray, what you need to know. A tragic loss sparks national debate. Why warm freshwater safety remains a tricky puzzle. Here's the alarming truth. A child's fatal encounter with a brain-eating amoeba at Lake Murray has exposed a critical gap in water safety measures across the US. And here's where it gets controversial. Experts insist that testing existing natural bodies of water for this microscopic killer might not be the solution most think. Understanding the silent threat. Naegleria fowleri, that microscopic parasite causing headache-inducing alarms across freshwater recreation spots, thrives in warm environments like Lake Murray. Unlike common waterborne pathogens, its attack method is uniquely invasive. It enters through the nose during water activities, migrates to the brain, and triggers symptoms ranging from headache to seizures within days. A race against time with nearly 100% fatality statistics.